Welcome everybody to Business Monday. I'm Josh Fenton, CEO and co-founder of GoLocal. Glad to have everybody on during the Small Biz Fuel segment. With me is Sarath from Ethide Laboratories. Welcome.
Thank you.
Yeah, great to have you here.
Glad to be here.
Big news, made a big acquisition, taking over kind of an old school Rhode Island company. Talk a little bit about Ethide Laboratories.
So Ethide Labs, or Ethide Laboratories, is private microbiology independent testing laboratory that serves the medical device, pharmaceutical, cosmetic, food and drug industry.
Who are your, can you talk about your customers?
Yeah, we serve about 95% of our customer base is primarily all the medical device manufacturers or the medical device companies. What we do is we test for the presence of bacteria on fully finished sterile disposable single-use medical device products, so they can be accepted and ready to be shipped to hospitals or other end-use customers.
So, you know, they're going to put a needle in my arm. Is that needle potentially coming to you to get evaluated, signed off on? That sort of evaluation is going to give it the green light to be able to go to Rhode Island Hospital or Partners. One of the Partners is entity up in Boston.
Yeah, sure. You can definitely think of it that way. There's some hidden steps that are in process when a fully finished manufacturing product comes out of a manufacturing facility. It typically goes to a sterilizer. So an industrial sterilizer takes the device in its final packaging and subjects it to different forms of sterilization to kill all the bacteria that may have contaminated the product. And then it's aerated for a little bit to let all the residual sterilization or the agents used in sterilization to wear out. And then finally, those packages are sent to an independent test laboratory like ours,
right,
where we test the presence both for the bacteria and also the presence of any residual sterilization agents on the package. And then once we do that, depending on the incubation time of each bacterial organism we test for, we issue a test report to the medical device manufacturer or the device company itself, and they would then use those to release the product to their distribution centers or the facilities directly.
Let's talk bacteria for a moment. Without naming any names, we don't want to get anybody in trouble. Are we seeing increases in bacteria in this process? Are we seeing consistency? And, you know, there's some days you're like, what are these guys doing, right? We just did an analysis and we're quite worried about what their process is.
I think the presence of bacteria or the amount of it is fairly consistent.
Okay.
Just because there's a large amount of regulations in place to guide the processes are done in a very, you know, with high integrity, high cleanliness, especially for a medical device manufacturer who's subject to FDA audits when they're doing, when they're manufacturing these devices, depending on the classification of them. It is fairly well regulated, and therefore you won't see a lot of spikes from the average amount of content or different bacterial types or classes from what you expect to see normally. So.
Do you get to see wonderful super bacteria and all sorts of gruesome things like that?
Superbugs? Not really.
You don't get any superbugs? Darn.
So yeah, we see pretty fairly what is expected in a health clinical OR or just patient use setting. We're kind of familiar to identify and recognize those bacteria and then report back to the manufacturer if there is any deviation from those, or if there is any deviation in the number that that is seen than what it's expected to be.
Where's the technology going? What do you see as the next phase of your business? How you can evaluate faster, quicker, more complete, etc.?
There's definitely a lot of automation that's been introduced into the industry, which has traditionally been very manual, because it requires some scientific technical assessment, although you'd have very standard test procedures and certain inbuilt in-house procedures that are there to guide and minimize any user error or technician error. You have a lot of things like automatic cell counting techniques that are introduced, where it could be a tool that could be used to measure the number of colony-forming units of bacteria present in a petri dish after a certain type of test, where previously it was measured by a technician kind of manually one by one.
Do you see AI transforming the industry over the next few years?
In this industry, especially relating to the services provided to the testing of devices for their sterility and microbiology, I think we're pretty far from that, because there's a reasonable amount of user input that's needed for anybody, especially a contract laboratory like ours, to release these tests. AI, I think, is well suited for those tasks that can be 100% automated. I wouldn't say we're opaque to that kind of process, but there is some sort of limitation for how much you can use completely automated.
And how's business? You just acquired the company just a few months ago, 4 or 5 months ago. How's business? Where do you see growth? How big can you be in Rhode Island?
Yeah, so I think there's a lot of room for growth. Traditionally, the business has been a family-owned, serving customers that just have known the company, organic growth.
Just relationship-based for 30 years.
Yeah, exactly. There's not a lot of effort put into how, what are some of the complementary services we could offer, what are the more number of services that we could offer on top of what we're offering to our existing customers. So customer feedback, trying to strategize from what priorities are, trying to grow into different type of tests, for example, some sort of histology testing or mechanical testing that could be offered in addition to the microbiology side of it, could definitely be explored and expanded to both existing set of customers and also to new customers.
Do you have free delivery? Grubhub it? Do you pick up and deliver?
No, so our customers deliver all the products to us, so we have a fair bit of FedEx and UPS knocking our doors every day. What goes out from our location is only a test report.
Right, of course. Right.
So.
Talk a little bit about, you've got 10 folks working for you down in West Warwick. Where can you grow that to? You mentioned that it was sort of a very stable, long-standing company built on relationships. Could you grow this 5-fold, 10-fold, 20-fold, and become an epicenter kind of for the industry and grow jobs in Rhode Island, which is what we all care about?
Yeah, so we're a service business. Definitely the kind of growth that a product tech company would see is definitely not applicable to us, but where there is opportunity for us to grow is when we talk to customers and see what their changing needs are, whether they're introducing new products to the FDA or even just acquiring new customers that have startup funding, small to medium businesses. Once we are able to get them to use some of these services, because these are mandated by the FDA, you almost have to go through these services either through us or through another independent laboratory. I think hiring is just a result of what we can or how much we can grow our company. Again, this is a service-based business, so the growth, we won't be hiring tens of people in a month or in a couple of months, but we've been growing steadily, I would say. And then, so we recently hired a couple of undergrad students right out of college, one out of Salve Regina University and one out of URI. We were in conversations with the director of biotechnology program at URI, and ended up making a couple of hires earlier this summer, and they've turned out to be great. And that's an indication of what's going to come as we talk to our customers and as they get more products in the pipeline for FDA approval. So our needs grow as
Are you going to be the cool place for grads to come and work as an independent lab in Rhode Island?
We're definitely trying to be.
Do you have a ping pong table?
We don't have it yet, but we'll put it in there for sure.
It's on order. Yeah.
Well, we have some great benefits. So I think our company focuses a lot on work-life balance. We do realize employees do work hard if they feel that the management is invested in their growth. So we try to make it a really fun place. We have an 8 to 4 policy. None of our employees technically work on the weekends. They don't. We also don't have any work for them to take home.
Right.
We
Right.
do.
Right. That's not a good thing if they're taking homework.
Yeah.
Right.
So we do some we do some sort of social activities together once every month, and we try to keep the place fun. And we're not a tech company, but we're trying to do whatever we can to keep.
That's great. You
place
worked
fun.
with the state to get the funding to be able to acquire the company. Talk a little bit about that process, and feel free to say anything negative you want about them.
Yeah.
Brian's in the other room. His feelings won't get hurt.
Yeah, I acquired the business, so there's no negative things to say. So I guess the funding worked out okay. So beginning when this idea came up in my mind, I was looking for some sort of opportunities, any experiences that would make me help me make informed decisions. So I started right off reaching out to RI Commerce Corporation, going to one of their webinars, and what are the legal aspects of trying to acquire a business. And I've actually attended a SCORE session with one of the mentors that the Commerce Corporation has that kind of went through parts of the deal with me to give me an independent opinion on it. And on top of that, I've gotten some sort of financial assistance through the Business Development Corporation that's helping me fund my working capital needs through the business right now.
Great. Congratulations. What's your biggest challenge?
I would say, as a small business with the amount of limited resources and capital that we have, making the strategy and coming up with a great strategy to put that capital to good use, because we're a small business, and one mistake from a financial perspective could cost you a lot, and sometimes irreparable damage. So one of the biggest challenges is, as I see different uses of cash that I can put in the business, my challenge is to pick the right one so everybody benefits from it.
Great. Thank you very much. Really appreciate you coming on.
Thanks for having me.
Thanks everybody for tuning in. We will be back tomorrow afternoon. Kate Nagel's got the 3 o'clock and 4 o'clock hour. It's a mishmash of guests tomorrow. Stay tuned. There's a number of things breaking. Obviously, we've been monitoring what's going on around the country this weekend with the shootings both in El Paso and as well as in Ohio. Horribly sad series of events that have kind of shaken the country to its roots. Also take a look at, came up at noon today, was Rhode Island ranked 3rd in the country for healthcare. Good news ranking for Rhode Islanders. We'll see you back tomorrow. Thanks everybody for tuning in.